structures and functions in our reproduction unit for female anatomy. So the female side view, okay, we have the bladder. This is the cervix, which is the opening to the uterus. The fallopian tube and the ovary. There are ovaries, there are two, and there are fallopian tubes. The uterus, okay, there's one uterus. The urethra, which is connected to the urinary bladder. The vagina, which is connected to the cervix and in turn the uterus. And the vulva, okay, the external structures. The cervix, which is the opening to the ovary. Sorry. The cervix, which is the opening to the uterus. The endometrium, which is the lining, okay, on the inside of the uterus. The fallopian tube, okay, the ovary, and then of course, as I mentioned before, the uterus and the vagina. So ovaries store and release eggs. They also produce estrogen and progesterone. This is just a visual representation of the mitotic events that happen before birth, okay, and then after birth. Fallopian tube receives the ovulated oocyte or egg, okay, provided it provides a site for fertilization, leads to the uterus, does not physically attach to the ovary, and is supported by something called the broad ligament. Okay, so we have the fallopian tube right here. The uterus is located between the urinary bladder and the rectum, is a hollow organ with a thick muscular wall, which expands through pregnancy and contracts to push the baby out during delivery. The functions of the uterus are to receive, to retain, and to nourish the fertilized egg. Okay, so here is the uterus between the rectum and the bladder. The endometrium is the inner layer inside the uterus. This allows for implantation of the fertilized egg and sheds off if no pregnancy occurs. This is known as menses, or more commonly known as the period. So right here, the inner lining is the endometrium. This is just a visual representation of changes that occur during the menstrual cycle in relation to the egg, okay, or the body temperature, different hormones, luteinizing hormone, follicle-stimulating hormone, progesterone, and then of course during the follicular phase and luteal phase, which we're going to talk about now. So phase 1, known as the follicular phase, between days 1 and 13, the pituitary gland secretes a follicle-stimulating hormone, more commonly referred to as FSH, causing an egg to begin maturing. This also causes estrogen to rise. Estrogen levels increase, causing the uterus to develop the endometrium. Okay, also causes LH, or luteinizing hormone, to be produced. This is also when the endometrium lining from the last cycle is shed, okay, through what is called menses, or period, if there was no fertilization. Okay. Phase 2, ovulation, okay, day 14. Ovulation is when the egg is mature and is released into the fallopian tube. This is between 12 and 24 hours that a person may have to get pregnant, or is most likely to get pregnant. There's several tests to know when a person is ovulating, and luteinizing hormone causes the mature egg to be released, okay, also causing progesterone to be produced. Phase 3 is the luteal phase, and this is between days 15 and 28. Estrogen levels decrease, progesterone levels increase. Progesterone maintains the endometrium in the case that fertilization has taken place, as well as fills the endometrium with nutrients for the egg. Okay. It also causes the body temperature to increase by about 0.5 degrees Celsius. If no fertilization occurs, the egg disintegrates and the endometrium prepares for shedding. The cervix is the opening of the opening to the uterus. And it's at the upper end of the vagina. As this develops a mucus plug during pregnancy to keep the amniotic fluid in. Amniotic fluid is a fluid that the baby is in that protects it and creates an environment for it to grow. Okay, the cervix expands from very, 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 very small, way less than a centimeter. Okay, a millimeter or less, to opening up 10 centimeters during labor for the baby to pass through. So you can see right here is where the cervix is, okay, the opening between the uterus and the vagina. The vagina extends from the cervix to the exterior of the body, behind the bladder and in front of the rectum. It serves as the birth canal. Okay, it also receives the penis during intercourse. So right here, so again, the baby would form in here, goes through the cervix and out the vagina. Okay. The urethra connects to the bladder to an opening just above the vagina and carries only urine. Okay, so a female, unlike the male, right, that female's urethra only carries urine, whereas a male's urethra will carry urine and sperm. The vulva, okay, are the external parts of the female reproductive system. We have the clitoris, the labia majora, labia minora, urethral opening, and vaginal opening. So the clitoris has thousands of nerve endings which are sensitive to touch and pressure. The labia majora protects the inner, more sensitive parts of the vulva. The labia minora, okay, these are glands produce a fluid for lubrication during sexual intercourse. And here they are again, the clitoris, the labia majora, labia minora, urethral opening, and vaginal opening.